Hello and welcome to this webinar, STI 101. And we are super excited. Oh, I am Lynn Barclay from the American Sexual Health Association. With us is Allison Footman from AVAC, and this is sponsored by Roche Diagnostics. Thank you, Roche. And so what we're going to be talking about is, all things STI. And when you can watch this video on both the ASHA website and STIwatch.org website. So take a look, send it, pass it around to your friends. This is going to be an amazing webinar, and so thank you. And now I'm going to introduce Allison Footman, who will introduce our speakers. Thank you.
Thank you so much, Lynn. Our first speaker today is Dr. Stacey Grinder, who is an assistant professor in the School of Public Health at the University of North Texas Health Science Center. She is a dedicated public health and STI advocate who has a PhD in public health, an MPH and undergraduate degrees in dental hygiene. Her work blends diverse disciplines, including sexual health, women and gender studies, implementation science, and oral health. And she integrates her experience when teaching human sexuality courses and mentoring students. Her research focuses on implementing evidence-based STI practices into communities to improve health equity and access to care. Thank you so much for joining us, Stacey. And with this, I hand it over to you.
Thank you so much. Let me get my screen shared today. Well, it's great to see all of y'all. I'm super happy to be here. Like Dr. Footman said, I'm Stacey Grinder. I do a lot of STI research and teach in human sexuality courses. STIs are my favorite topic, so I'm really super excited to get to talk to you today. So I know you're wondering, what are we going to talk about? Well, I love to talk about STIs, so probably a lot of things. But first, I'll give you an overview of just kind of where we are in the world of STIs 101, just basically what we're up against and how things are going out in the world. And then I'm going to talk specifically about chlamydia, gonorrhea, and syphilis. Some of the questions I'm going to try to answer are, what are they? How do people get these infections? How many people have them? What are the symptoms? And then overall, how do we prevent them? And I do want to give a little shout out to Dr. Footman because she gave a presentation, STIs 101, in a course that I was teaching. And it was so wonderful. I modeled the structure of this presentation after that. I'm not going to talk about any treatment or diagnosis. I will let that pass on to Chase once I finish up. So where are we at? STIs are super common. All of them are preventable. Most of them are curable. So that's great to know. And in 2022, there were about 2.5 million cases of syphilis, gonorrhea, and chlamydia in the US. So a lot. The most alarming concerns that we're really seeing right now are in the increase in syphilis infections and congenital syphilis infections. And I'll talk about both of those as we move on. One of the key points I want to bring up and talk about is that most STIs occur in the age group that's 15 to 24-year-olds. And in 2022, most recently, it was about half of the infections. All of the new infections occurred in this age group. So just want to be aware of it. And once we have this information, we're really focused on targeting this age group and improving the sexual and reproductive health in that population. You will see it as a trend throughout the presentation. Almost all of the STIs I talk about are the highest in this age group. And I just think it's important to call attention to that as we're working on this. How much do STIs cost? This number is absolutely astounding to me. The medical cost for all of the STIs that were diagnosed in 2018 was $16 billion. That is a ton of money. And when you break out chlamydia, gonorrhea, and syphilis specifically, it was $1.1 billion in medical costs. So that's a lot of money, and that doesn't even consider any of the social costs that we talk about. So missed work, things like lost productivity, other things like that. So it's even more than this number. This is only medical costs. I also want to point out that we talked about young adults being the most at risk population. For young people ages 15 to 24, they're about 60% of these costs, so a good proportion. And then care for women specifically accounted for nearly 75% of this total. I am super excited to start with chlamydia. It's a good one, so I can't wait to tell you everything that we have going on. So I am going to answer the questions that I told you about at the beginning. What is chlamydia? It's a bacterial infection that can affect both men and women, and anyone who has sex could get it. Thankfully, it's very easy to diagnose and super easy to treat, but it is very common. It can also be spread through pregnancies, and most of the infections that we'll talk about today can too. They can be spread from a pregnant person to a fetus, so it's important that we're aware of that as well. And how do you get this? You get it from having sex with someone who has a chlamydia infection. And this could be through anal sex, vaginal sex, oral sex, any kind of sharing of sex toys, any kind of sexual interaction with someone who has a chlamydia infection. It's spread through sexual fluids like vaginal fluids and semen. And also you can get chlamydia infections in the genitals, the rectum, and the throat. And how many people have it? In 2022, which is the most recent data that we have, it was about 1.6 million cases. And like you'll see, this was even higher in 15 to 24-year-old age groups at 58%. What we see in this infection is that oftentimes there are more cases in women, and it gets really complicated when you're talking about the outcomes if someone has this infection and it's not treated. So in women or people who are assigned female at birth, it can lead to pelvic inflammatory disease and infertility. And for men and people who are assigned male at birth, some people get a penile infection that can cause a fever and pain in the tubes that are attached to the testicles. So this can be a really painful infection. But this is super rare because men rarely have any issues, any symptoms associated with chlamydia. And untreated chlamydia and all of the other infections that we're talking about can increase your chances of getting another STI like HIV. So chlamydia is a problem because a lot of the times it doesn't have symptoms. But like we talked about, it can lead to some pretty serious health outcomes. If the symptoms do occur, sometimes they might not even be noticeable or appear for a while after you've had sex with someone who has an infection. So for women and people who are assigned female at birth, some of the symptoms might be an abnormal discharge that could have a smell, pain during sex, bleeding in between periods, or a burning sensation with peeing. And for cisgender men or people who are assigned male at birth, it could be a discharge from your penis, pain or a burning sensation while you're peeing, and then pain or swelling in one or both of the testicles. You should definitely see a healthcare provider if you have any symptoms like this, or if you think you have something that could be a symptom like this, just because your healthcare provider can get you tested. So, but one thing that I want to really let you know and keep in your mind is that most of the time there are no symptoms for this infection, and you can spread it to someone else without knowing that you have the infection. So it's very important to get testing, because if you can diagnose it early, you can have treatment. And I'll let Chase talk more about that, but we have some great testing and treatment options as well. Now we're moving on to gonorrhea. It's number 2 in our lineup today. What is it? Similar to chlamydia, it's a bacterial infection. Anyone who has sex could get it. It is curable, but it's a little bit more complicated than chlamydia. It is super common among 15 to 24-year-olds, and it's often called the clap or the drip. Like chlamydia, gonorrhea is curable, but it's getting a little bit more complex because it's developed resistance to a lot of the antibiotics we use to treat it. And we're down to one last class of antibiotics that are effective and recommended to treat it. Very similar to chlamydia, gonorrhea is spread through sexual fluids like vaginal fluid and semen, and also again through pregnancy. So it can pass from a pregnant person to a fetus if the person has it during pregnancy. How many people have it? So again, still a very common infection, but less than chlamydia, about 650,000 cases in 2022. And this is interesting because we see more cases in men with this infection. The peak of the age group happens around 20 to 24 years old, both in men and women. And infections are higher among people who are in this age group, people who have a history of having another STI, and men who have sex with men. For women and people who are assigned female at birth, again, this infection can lead to pelvic inflammatory disease and infertility. And for men or people who are assigned male at birth, it can lead to a painful condition in the testicles that can sometimes lead to infertility. But again, this is rare for men, and gonorrhea can also spread to your blood and joints. This is life-threatening, but it's not happening very often. So Again, untreated gonorrhea can lead to easier risk of transmitting and contracting HIV and other STIs. So it's also really important to be tested for this infection. What are the symptoms of gonorrhea? Again, a lot of times it doesn't have symptoms, especially for women and people who are assigned female at birth. If you do have symptoms, they're really dependent on the reproductive organs that you have. So for women, they might include an unusual discharge that could be white or yellow, pain during sex, bleeding between periods, pain or burning when you pee, and then pain in your pelvis area or in your belly. And men or people who are assigned male at birth are often have some symptoms here, but you might not notice some signs of the infection until a few weeks after you've had sexual activity with an exposed person, meaning that you can unknowingly expose people. Again, you should see a healthcare provider if you have any symptoms or anything that you're concerned about. But a lot of the time, there are no symptoms when someone's infected with gonorrhea. That's why it's really important to see a healthcare provider for testing. Okay, we've gone through chlamydia and gonorrhea, and now we're going to talk about syphilis, which is the STI I find by far the most interesting. And I can't wait to tell you all about it. What is syphilis? Syphilis is an STI that is a bacterial infection. It is also treatable with medication, but without treatment, this infection can cause some really serious health outcomes. Syphilis develops in 4 stages. They're called primary, secondary, latent, and tertiary or late stage. And I'll talk about how the symptoms appear for each one. But antibiotics can treat this and do a really good job at it too. How do people get it? The same way that we are contracting other STIs. But syphilis is really problematic when an individual has it during pregnancy because it can cause a lot of negative health outcomes for a fetus. And people who are at higher risk are people who have unprotected sex, men who have sex with men, people who are living with HIV, and people who have tested positive for another STI. In 2022, there were over 200,000 cases, and we see more cases in men, but cases in women are increasing dramatically over the past few years. The most infectious phase of the disease, which is the first 2, primary and secondary syphilis, there were about 59,000 cases, and these have increased for almost all age groups and almost both genders. If you leave it untreated, syphilis infection can cause some really serious problems like heart, eye, and organ damage, and people who have syphilis can also have a higher risk of being exposed to HIV and contracting it. I also want to spend a little bit of time and talk about congenital syphilis because this is really interesting. Congenital syphilis is when a fetus is diagnosed, or a fetus or a baby is diagnosed with syphilis during when they're born. The infection occurred during pregnancy. There were about 3,800 cases in 2022. This is up 183% since 2018. It's wild. It is on the rise, so make sure that you're on the lookout for that. It's really important because it can have some really serious impacts on the baby. For adults, we're talking about heart, brain, eye, and organ damage. And then for congenital syphilis, if left untreated, it can lead to stillbirth, miscarriage, and then if the baby survives, to foreign bones, brain, and nerve problems as they develop. But again, we can prevent this through screening and treatment. If you're diagnosed early, we can provide care for you that will prevent any negative health outcomes. Syphilis is super complex. It's often known as a great pretender because it has a lot of different ways it will manifest, and it gets confused a lot with other infections. So I'll talk about these in stage. The first stage is primary syphilis. It happens up to about 12 weeks after you've come in contact with syphilis. People will usually get a smooth sore on either their mouth or genitals. It will go away, but that doesn't mean that the syphilis has gone away. Secondary syphilis happens about 1 to 6 months after the sore goes away. People see a rash a lot of the time, and they get other symptoms that appear kind of like flu symptoms: fever, muscle aches, headaches, swollen lymph nodes, things like that. Both of those stages, primary and secondary, are when it's easy to transmit to other people. Then the infection kind of transitions into this latent or hidden period. Oftentimes people have no symptoms and can get flare-ups from time to time. But at this point is when the longer term outcomes start to develop. So someone might start having damage to their heart, bones, nerves, or other organs. And then we cross over into latent or tertiary or late stage syphilis. That's where the serious health outcomes are manifesting, brain damage and nerve damage, things like that. But like I said before, all of these infections can be diagnosed and treated. We have some really great care that we can provide to people, and the infection can be prevented as well. So let's spend some time and talk about prevention. I'll talk a little bit about prevention, and then we'll kind of go over to Chase, who will talk about testing and treatment, which it kind of completes the puzzle. There are quite a few ways to prevent STIs. The first one is abstinence. Of course, the most reliable way to not get exposed to a sexually transmitted infection or an STI is to not have sex. But most people like sex and do have sex, so we'll talk about some other ways that you can reduce your risk as well. One is reducing the number of sex partners that you have. This can really decrease your risk overall, but it still is important that your partners are being tested and you're being tested as well, and sharing those results with each other. Mutual monogamy is another way that you can reduce your risk. It means that you're having sex with one person who agrees to only have sex with you as well. So it's important that in that relationship, both, you know, the status of both partners. So sharing your results is really important there. And having a conversation about STIs is one of the most reliable ways that you can reduce your risk. So make sure you're having open and honest conversations with your partners. Using condoms. This is a great way to reduce STI transmission, but it is a little complicated, and there are some specific things I just want to bring to your attention for you to consider. When I'm talking about external condoms, sometimes known as male condoms, and I am specifically talking about latex ones. They're often used either on a penis or a sex toy, and to prevent STIs, you need to use a condom correctly and consistently, so every time you're having sex. If you have latex allergies, you can use other types, so polyurethane condoms, other materials, but some of them do have a higher breakage rate, so make sure that you're looking out for that as well. And then natural membrane condoms like lambskin, those aren't effective at preventing STIs. So finally, I want to talk just briefly about knowing your STI status. It's a critical step in stopping STI transmission, because if you know you're infected, you can take action and protect your health and the health of other people. So be sure you're talking to your healthcare provider, if you have one, to determine whether and when you need STI testing or treatment. So I want to really start wrapping things up. I want to bring a couple of more points and then kind of pull everything together. So it's estimated that about 20% of the US population has an STI. This is approximately 1 in 5 people in the US. So a lot of people on any given day. But while I was talking, I kind of talked about some groups or groups of people who might have higher risk. And when I'm talking about that, it's important to know that these differences aren't because people are having different types of sex. It's because they might have different access to healthcare than other people, or it's because they didn't have easy access to sex education or other resources, maybe even condoms to prevent STIs. So it's also important to know that places that people live can impact this. So in areas where there are more STIs, each time someone has sex, you're more likely to encounter a partner that has an infection. So it can even happen when your behavior is similar to someone else who lives in an area where there are lower rates of STIs. So recognizing these differences is really an important step as we move forward. It helps us start working together to address these inequities and kind of figure out what's going on behind them so we can improve them. And our ultimate goal is to reduce the impact of STIs on individuals and in the population. So in closing, my key takeaways. A lot of STIs don't have any symptoms and you might not know you're having them. So it is super important to get diagnosed or tested and then treated if you need it. It can help the STIs stop spreading, so we have lower rates overall, but also protect your health. So thanks so much for listening. I will stop there and pass it back to Dr. Footman, who will give it over to Chase.
Thank you so much, Dr. Grinder, for such an incredible presentation. I am grateful for the information that you shared. And with this, we will move our presentation over to some STI testing information presented by Dr. Chase Cannon, who is an assistant professor of medicine at University of Washington and medical director for public health, Seattle and King County Sexual Health Clinic. He is an infectious disease specialist and primary care provider for gender diverse people living with HIV or taking PrEP, including persons who use drugs or have unstable housing. His research is informed by clinical practice and focuses on implementing existing and novel HIV and STI prevention strategies for LGBTQ+ and other socially marginalized populations. He believes that collaboration is the best approach to increase knowledge and empower people to meet their health goals. So thank you so much, Dr. Cannon, for joining us today. And with that, I pass it over to you.
Hey, thank you very much, Dr. Footman. Does this view look okay for everybody?
Yes, it's perfect.
Great. Okay, so following up on what you just heard about all of the data and sort of the epidemiology about STIs, now we're going to talk about testing and treatment, so specifically focusing on what you need to know. So I want to start with an introduction just so we're all on the same page because some of this can be a little confusing when we talk about all of the different STIs and then how we test for them. So as we start, I want us all to use the same language. And if you hear this from your healthcare providers or from friends, you will know sort of what people are talking about. So there's two main strategies that we use when we talk about testing. So one of them is called screening. And so that is when you get checked for an STI whenever you don't have symptoms. And some people may use the term asymptomatic. That means the same thing. So this is, you go in, you're asking for a checkup, and you are going to get screened for gonorrhea, chlamydia, syphilis, et cetera. And the types of people who will be sort of recommended for screening, it really will depend on the sex that you're having and then sometimes other risk factors. So specifically, if you're taking HIV PrEP or pre-exposure prophylaxis, there's a set frequency that we recommend people be tested. And as you just heard from Dr. Grinder, that pregnancy is important as well because the infection can be passed on to the fetus or the baby. So that's another group of people that we really recommend screening. The other category is what we call diagnostic testing. And so that's when, as you heard, somebody has symptoms like rash on their body or genitals, the burning with urination or discharge, and they're really going in to get tested because they want to know if they have an STI that's causing those symptoms. So one is, you're getting screened when you have no symptoms, and the other is you have symptoms and you're getting tested. So what are the different categories or sort of the methods that you can be tested? So you've probably heard or maybe seen commercials or advertisements on social media about what's called home testing or sometimes self-collection at home. And so typically this is only for gonorrhea or chlamydia, and there are certain types of specimens or places on the body that you can be tested, either urine or a vaginal swab for women. And this, has an advantage in that it's convenient and you can do it from home. You have privacy and you get results sent back to you by your email or text message. But the downside is that this isn't usually covered by insurance, and there may be an additional cost if you have a consultation to talk about treatment if the test is positive. So that is one option that you could use, but it's not necessarily the most common for most or accessible for most people because of the cost. The second type is called rapid testing, or you may also hear the term point of care testing. So we have different options for this, chlamydia, gonorrhea, trichomonas, syphilis, a lot of different rapid tests. So these are often done in a healthcare facility, and the advantage of this is that you will get your results very quickly. So for some HIV tests, it can be as quick as 1 minute. And then for some tests, it could take, an hour or 90 minutes. So the advantage of this is that, you get your results right on the spot, you know exactly what your status is, and then you can talk to your provider right then about getting treated. And so this can reduce sort of the loss to follow-up, so preventing people from leaving the clinic or the facility and not knowing their status, and there's a risk that you could pass this on to your partners. So it helps you in terms of being able to notify your partners, get treated right on the spot, and then making sure that you are taking the steps to protect yourself moving forward. And then the last group is standard testing in health center. I think that's the most frequent category and what people are most familiar with. So there's a really big menu of different testing options and different types of body sites that can be tested. And in most cases, you're going to get testing and treatment in the same place. And for most people as well, covered by insurance. And so you may not have to pay much if you go to a clinic that has either a sliding scale or can work with you around the finances. So how do we know sort of who should be tested and what we are supposed to do as providers? So there are a lot of organizations that have what we call guidelines, basically, or like a list of recommendations and kind of best practices. So CDC or Centers for Disease Control and Prevention is maybe the most commonly used, and they have an app that people can go on and sort of type in their age, their sex or gender, and then it will tell you what STIs you should be screened for. And there's also another organization called the United States Preventive Services Task Force that has guidelines around STI, and that one's important because that's what the insurance companies look at. So once the USPSTF says you should test this person for gonorrhea, then all of the insurance companies are required to pay for that test for certain age groups. And then other state or local health departments or your clinic may have their own specific rules about who they test, maybe based on the type of people that they see in their clinic or the cost of the testing. So how do these guidelines come about? Well, they're really carefully developed by experts in STIs and other people who make policies and laws after they look at all of the different things that you can see here on the slide. So they consider the epidemiology, which you just heard about, like who are getting these infections, how many are there in the United States at any given point. They look at data from research studies, and then they look at as well the cost of all of the testing, so they can sort of balance how this is going to sort of strain or affect the healthcare system. And they pull all this together, and then they make these recommendations, and they're often grouped by age categories. As you heard, young people are often most affected by STI. They can group it by the type of STI, so chlamydia or gonorrhea, for example, or by population, so for people with HIV or people who are pregnant. So I'm going to focus on that sort of approach for this talk, focusing on the population, because I think that's the easiest way for you to kind of wrap your head around who should be tested and when. And I just want to make the caveat that in some of these guidelines, and you may see sort of online if you're reading, there's not always a good distinction between sex and gender. So I will try to do my best to be careful about that, but just know we all recognize that there's not just binary sort of female and male. There's a lot of different sort of people on the spectrum. And so we try to do our best and try to making all of these recommendations as inclusive as we can. So let's talk about who should be tested. And I'm going to focus, because there are so many STIs and there's a lot of information that we could give you, I want to focus on just chlamydia, gonorrhea, syphilis, HIV, and hepatitis C. So there, again, are more things we could talk about. Happy to do that in the Q&A, but let's focus on those. So who should be tested? As you've heard, any person who has ever or is currently having sex is at risk for getting an STI. And based on the national data and all of the graphs that you saw earlier, these are the groups of people that you see listed here that are maybe most likely to have an STI just based on the data. So adolescents and young people, people who are pregnant, people who are from minoritized racial ethnic groups. So in the United States, that's Black African American people, Hispanic or Latinx people, and then also Native American and American Indian people. As well, men who have sex with men, and then transgender people, but specifically transgender women are most affected. So let's start first with cisgender women who are sexually active and who are not pregnant. I'm not going to discuss pregnant people because that's a sort of more complicated topic that we could talk about later. But for cisgender women, it's broken up by age categories. So for women who are less than 25, they should be screened for chlamydia and gonorrhea, and that can be done with a self-collected swab or specimen like urine, or it could be done by your provider during the time of an exam. So they will do a swab or get urine and then send that off to the lab and get your chlamydia or gonorrhea result. And it's recommended that you do that annually, and then you can be retested every 3 months or so after you get treated for an STI, just because we know that people who have already had an STI are at risk again for one in the future. And then for women who are 25 years and older, again, chlamydia and gonorrhea is recommended to be screened from the same body sites. But we say that this is based on risk rather than us saying it should be every single year or every 3 months. And so some of those risk factors might be if you have a new sex partner, if you have more than one partner, you have a partner who is not monogamous or they have other partners, you've exposed to an STI, you're not using condoms correctly or consistently, or you have a history of exchanging sex for goods or services or money, or you've been incarcerated before. So remembering all those risk factors, I know it's a long list, but you'll see that kind of come up again and again. Syphilis, again, for increased risk, you want to test all of those things we just talked about. And then HIV at least once in your lifetime, either an oral swab or blood. And then hepatitis C in adults who are 18 or older by a blood test. So what about cisgender men who have sex with women? So similar categories again, chlamydia and gonorrhea can be tested either by the urine or genital swab. There is no specific recommendation from all of those groups that you saw on the frequency. So we sort of limited based on whatever the person's risk factors are. So if they were recently in jail or they have a partner who's engaged in sex work, then we might offer them the chlamydia or gonorrhea screening. For syphilis, because we've seen increasing rates in people across the United States, we really do recommend that people be screened at least once, but usually it's every 6 to 12 months, depending on their risk, and that's with a blood test. And wherever you live may have sort of specific guidelines about that that may vary a little bit. For HIV, if you're going in to get an STI test, you should also always have an HIV screen. And we recommend that be done at least once between the ages of 13 and 65, either with an oral or a blood test. And then hepatitis C, again, in adults at 18 or older, at least once with the blood test. For cisgender men who have sex with men, it's a little more complicated, so we'll walk through this. I know it's a sort of busy slide. So for chlamydia and gonorrhea, there's lots of ways that we could test from urine or genitals or the rectum or the throat. And that really depends on where there was exposure during sex. So we ask people, what type of sex you have, and based on that is the way that we order the tests for screening. So for MSM, that should be done annually, but can be up to every 3 to 6 months if you're taking HIV PrEP or pre-exposure prophylaxis or taking Doxy post-exposure prophylaxis, Doxy PEP. For syphilis, same idea. It's a blood test and done at least annually or every 3 to 6 months. The little sort of twist with syphilis is that the type of test that is ordered really depends on if you've had history of syphilis in the past. So if you've never had syphilis before, there is a certain type of test, even a rapid test that we can do that is useful. But if you've had syphilis before, there's only one type of test that should be ordered. And so it's important that you understand that as well. And so you can talk to your provider and say, hey, I've had a history of syphilis, just to let you know. For HIV, we use this opt-out approach, which is basically we're going to say everybody 13 to 64 is getting screened for HIV unless you tell me that you don't want to be tested. Otherwise, it'd be every year or every 3 to 6 months. And for this group, for cisgender men who have sex with men, a blood test is actually better than the oral swab. It's fine that you could do that, but if you're taking PrEP or Doxy PEP, we actually prefer the blood test because it's more accurate and it can tell you whether you acquired HIV in a shorter period of time than the oral swab test. And then for hepatitis C, similar, ages 18 or older, and then we recommend this be done annually if a person's taking PrEP or they're injecting drugs. Okay, and then for transgender and gender diverse people, really it depends on the person's anatomy. So if they've had any sort of gender affirming surgery, it will depend on sort of what body site we test. So generally speaking, we say that for people who have a cervix who are younger than 25, annually we would screen that site for chlamydia and gonorrhea. If they're older than 25, it's based on risk factors, the ones that we already talked about. You can do rectal and throat screening if you've had exposures there. And then generally, again, if you're on PrEP or Doxy PEP, we recommend people be screened more frequently. Syphilis is the same idea, a blood test, and it depends on the type of, history that you have with syphilis, which one we order. For HIV, we want to offer transgender and gender diverse people to be screened at least once, and that includes all people. And the frequency, and sort of when you get repeat testing will depend on what your exposures are and what kind of sex that you're having, and whether or not you're on PrEP. For hepatitis C, at least once at age 18 or older, and then if you're on PrEP or injecting drugs, we recommend that you get this every year. Okay, last really heavy slide with the data. So this is another important group, so people living with HIV. We do have really good guidelines actually for people who live with HIV that tell us sort of when and what type of testing we should do. So for chlamydia and gonorrhea, it's any exposed site on the body. We want to get a swab from there or a urine sample. And this should be done at the first HIV care visit. So when someone's going to their doctor to establish care and get treatment for HIV, and then at least annually after that. For some people, like men who have sex with men who have HIV, or if they have other risk factors, we may get testing every 3 months. And this, again, can be either self-collected or done by your provider during an exam. Syphilis is the same. It's a blood test at those same intervals. And then hepatitis C, we recommend for people at least age 18 or older, and at the first HIV care visit, and then every year after that. Okay, so that's a lot of information. You're free to kind of review those afterward and sort of find which of those slides fits for you and sort of which testing you should be getting and when. So now let's talk about how you get tested and treated. So there are a lot of different places that you can go. I think the most sort of common that people hear about is an emergency room or an urgent care clinic. They actually provide a lot of screening and sometimes treatment in the United States. You know, the downside with that is there can be long wait times. They don't necessarily always make appointments. And so you might have to wait to get your results or to get screened. And then sometimes the providers there are really busy. They're focused on a lot of other things that are emergencies, so they may not be sort of up to date on all of the recommendations, but it's still an option for some people if that's all you have available. Otherwise, there are what are called sexual health or STD clinics, where you can meet with an expert in STI who are in a public health setting usually. And that is a good option because often they won't charge you anything. It'll be low cost or even free. Your regular healthcare provider can also get testing. So you can ask when you're going in for your regular checkup to have added STI testing. So if they don't offer it to you, you should ask your provider about it. And then at the bottom, there are a few other options that are maybe not as common, but just good to know. So Get Tested by CDC is a place where you can sort of log on, type in your location, and it will show you where testing options are for you. And there are some online services we talked about briefly in the beginning that are convenient, but they could be really expensive because they're not covered by insurance. And again, there's no guarantee that the follow-up will be included in the cost of the testing. So has some drawbacks there. And then some pharmacies actually provide sexual health care too and PrEP. And this is a place you can actually go and get a free, or not free, excuse me, a self-test that you can purchase where you can do an oral swab for yourself and know your HIV status at home. So what are some things to know? You know, so say you went and got tested and somebody says you have chlamydia. What are some things to know about treatment? So again, all of these are curable except for HIV. We have excellent treatments for that, but there's no cure just yet. But for gonorrhea, chlamydia, syphilis, and hepatitis C, we can give you treatment to cure all of those infections. So what does it take for gonorrhea? Almost always you'll get an injection of antibiotics, and rarely we would treat it with oral pills. So for most people, you'll get a shot. For chlamydia, we usually treat this with oral antibiotics for 7 days. In some cases, we can give you a one-time dose of oral pills, but that's not an option for everyone. And then for syphilis, as you've heard, it's a little more complicated because there are different stages of syphilis. And so depending on what stage you're diagnosed in, you'll either get 2 or 4 weeks of oral pills, or you can get in a single injection of antibiotics, or you would get a weekly injection for 3 weeks. For complicated cases or when it's really severe, it goes to the brain, the eyes, it actually may require you to get IV antibiotics. So you were diagnosed with an STI, now what? So it's really important that you know what your results are and then understand what the plan is. So ask your provider, what's next? What do I need to do? Are you going to set up treatment for me? And then make sure you understand what type of treatment it is and how long it will take for you to be cured. It's always important to notify your partners that they should also get tested and treated so that you don't go back and have sex with the same person who maybe gave you chlamydia, because then it'll just be this cycle where you're passing it back and forth to each other. And if you feel like you don't want to talk to your partner, you're embarrassed about it, or you don't know exactly what to say, your provider can help, or also public health can contact them for you. And then protecting yourself and partners is always important. So we recommend to most people waiting at least 7 days after injections or until they've finished all of their antibiotics before they have sex again. So this is sort of my summary slide. You've heard this, knowledge is power. You want to make sure you're getting tested, find out where you can go to do that, what parts of your body need to be screened, how often you need screening, always seeking care if you have symptoms, getting treated, knowing where you can go if you test positive, helping to notify your partners, and then finding out if you need a test of cure or when the next time you need to come back to be screened is. And then there are a lot of recommendations and sort of opportunities for prevention. You've heard about some of them from Dr. Grinder: condoms, knowing your status, getting vaccination and regular testing. So all of this is really to say, keep yourself and your partners healthy. You really need to know your status. So that's the main takeaway.
Thank you so much, Dr. Cannon. And so now we're going to enter into the Q&A session. So Stacey and Chase, this gets to be like a little bit more informal. And also, if there's anything that you ever feel you weren't able to cover in your slides, always just provide this information. But our first question for you guys today is, what is the difference between an STI and an STD?
This is something I feel like we should have addressed at the beginning, but it is complicated, right? So I read this article that was just pages and pages talking about the language we should use. And I'm one of those people who will be there with that, like, okay, yeah, let's change it. But kind of the differentiation, and y'all can jump in, kind of the differentiation that I thought is that disease suggests that there's a manifestation or a symptom or a sign, and infections don't always have symptoms. So that's why I kind of lean towards infection, but lots of people have opinions and thoughts. What do you think, Chase?
Yeah, I agree with that. And I think the other part is when you hear that somebody has a disease, it sounds like really nasty, and it's sort of like it feels like someone's dirty, or it has like a stigma with it. Whereas you just say like, oh, I have an infection, I'm getting treatment for it, I'll be fine. It sort of feels less, I guess, heavy, or that it's blame on the person. Yeah. So I think things have shifted over time to now be STI, which is infection, because as you said, a lot of these you can be treated and sort of cured from, and you move on. It doesn't cause any complications.
And people say that you can get an STI through intimate touching, oral sex, anal sex, or vaginal sex. Is all of this true?
So I would say, what do you mean by intimate touching? Tell me more. Tell me everything. But
So, oh, okay. No, never mind.
no, but it's not spread through, typically when we're talking about the STIs that I talked about, it's not spread through kissing or casual contact. These infections don't really live well out of the body. But it is transmitted through contact with infected fluids. So it would have to also then come in contact with suitable body tissue. So it depends on the type of intimate touching.
Yeah, I would say there's actually in our field sort of some controversy. It's like a little spicy because there are some researchers who feel really strongly that even just by kissing that you could transmit gonorrhea. So a lot of people in Australia have studied this, and so it's not an answered question yet. I think it's still a little bit of a theory, but their idea is that basically if you kiss someone who has gonorrhea in their throat, you could pass it on to them, and that may be how people end up picking it up without knowing. So there are some studies that are going to be done to look more at this, but I think that's an open question for right now. There are some STIs like monkeypox or mpox where intimate touching definitely can give you the infection from somebody who has it. We didn't talk about that today, but that's one that I think comes to mind.
And if someone has a bump on their genital areas or pain when they're peeing, how do they know if they have an STI or not?
You go first this time.
Yeah, I think I would say you should always get checked out. So talk to a healthcare provider. They will often need to do an exam so they can take a look at what the bump is, and they really can't say unless they see it. And then they do testing and sort of let you know what they think.
Yeah, we don't have enough information from that.
And really, just to clarify, like, what if someone's a little smelly? Is that going to tell me that they have an STI or not? Like, what if their genitals are a little smelly?
Yeah, I mean, is that just because they aren't somebody who washes them regularly, like a little funky after the gym? I don't know. It's hard to say. Like, I think that on its own doesn't necessarily mean that someone has an STI. But one of the ways that syphilis can show up is it can cause sort of bumps or sort of a rash on the genitals that can be really smelly. So maybe sometimes, but I would not say all the time.
Interesting. Yeah, I would say talk to your partner and go get tested and make sure you know for sure.
And if someone is treated for an STI, does this mean that they can't get that infection again?
No.
Unfortunately, no. I wish. No, no, they can definitely get it again. And it's super, this is, I think, makes the case for why it's important to get your partners treated as well. And like you were talking about earlier, Chase, it can go back and forth and passing back and forth between people. So yeah, if you get treated once, that doesn't mean it's gone forever. If you are doing the same behaviors with the same people.
Agree.
And so, Chase, you mentioned all of these guidelines for testing and treatment, but what happens when people can't remember these guidelines? How do I know when I should get tested? How does anyone know when they should get tested?
Yeah, it's a good question. There are so many guidelines out there, and like, there may be CDC, and then like whatever clinic you work in or your public health department locally may have different guidelines. So I mean, as providers, look it up as well too. Sometimes we can't remember all these things. So you shouldn't necessarily be expected to, but if you go to a clinic and you say, hey, I want to get screened for STIs, they will let you know based on your age, who your sex partners are, what your history is, whether you're pregnant or not, what is recommended. So you don't necessarily have to remember that, but it is interesting that you could look it up on CDC's website and learn more, and you can always kind of find that resource that way.
So let's say there is a person who gets an STI test and they find out they have chlamydia, but then they kind of forget about the test. Or maybe they're a little scared to go to their doctor and get treatment or go pick up this prescription. What advice do you have for that person who's maybe scared to move from the testing phase to the treatment phase when they might have an infection?
No, you can go first.
Okay. Yeah, I think that's common, right? So, especially for younger people or someone who's never had one before, like, it can be an embarrassing experience, or, people feel sort of ashamed about it. So our goal as providers is always to like make a safe space and talk about sexual health as we have here, hopefully openly and in a not judgy way. Like, we're not here to sort of dictate what kind of sex you have. We just want you to be healthy and your partners to be healthy. So I would say, going to a provider that is sort of well versed in sort of sexual health, they can help you through this process. Often there are like nurses or community health workers also who can talk through this with you. And it's not a scary process. You just get antibiotics, you take them for, a week, sometimes one dose, and then the infection goes away. So it's not a scary thing.
Yeah, and if we think that 1 in 5 people has had an STI, then it is pretty common. That should make you feel like you're not alone. And it is pretty easy treatment.
Yeah. Hundreds of thousands of people
Yes.
are diagnosed with chlamydia every year. So you were, yeah, definitely not alone.
And so, what happens when a person is looking for an STI test? They want to get tested, but they go to their clinician, they go to their healthcare provider, and they can only get a urine test. Should they seek other places to maybe get those vaginal, anal, or oral swabs? What are really some of the thoughts around that?
Yeah, that one's tough. You do run into that sometimes. So unfortunately, not all providers or, healthcare personnel are educated about what needs to be done. So, I hear sometimes that patients will say, I had to like talk to my provider about what should be done and like show them like, hey, CDC actually says like I need these other tests too. So you can always advocate for yourself, but if you're running into sort of barriers, I think going to that website and sort of looking else where else you can get screened. So a sexual health clinic or an STI clinic will definitely be a place where there are experts who know and can order the tests for you. So that's probably what I would recommend.
If you have the option to do that test and then pursue other options, I would consider that too, especially if you have symptoms or something going on. I would take any test I could get at that point and then see what else I could add on top of that. I think that could be an option too.
Yeah, I have seen some people who are sort of turned down by their primary care doctor or somebody else that they see like an urgent care, and then they end up going to like one of the online sites and sort of ordering tests that way. You can do that, but as I said, like that can be pricey, so that may not be accessible for everybody. And then if you have a test that's positive, you still have to figure out how you get treatment because they don't necessarily always do it online. Sometimes they do. So I think, yeah, just going to an actual clinic where somebody is knowledgeable about it is the best option.
Yep, agree.
And so overall, what do you think is the most important thing for people to know about sexually transmitted infections?
I'm going to go with that they don't have symptoms a lot of the time, and you never know until you're tested.
Yes. Yeah, I agree with that. That so many people are surprised. They're like, I'm so careful, I've never, cheated on anyone, but it doesn't matter. You can have an infection and not know it. Even from 10 years ago, you could have had syphilis and never had an idea. Um, and so, yeah, it's always important just to get screened. And the other part I would say is, again, reminding people that these are super common. So, if you are diagnosed with one, again, it's nothing to be ashamed about. It happens to, 20% of people at some point in their life if they're having sex. So you get treated and you move on.
Yep. And treatment's super easy too. I think that's something we don't talk about a lot. And thinking if I were in that position, I would be freaked out by what the treatment is. So just knowing that it's antibiotics and it's quick and you can move on, I think is good to know.
And so, Stacey and Chase, my final question for the two of you today is that you both have so much knowledge and passion about STIs. And so, how can other people become an STI champion or advocate like yourself?
Good question. Yeah, so I think there's sort of two ways that I'm thinking about it. So one is if you want to kind of get into this field, there's a lot of opportunity for that. So many different sort of positions and things you can sort of pursue in terms of your education or training to be in the sexual health field. So that can be anything from being a medical assistant to a nurse to a community health worker, a health navigator. There's so many options. You don't necessarily have to go to medical school or get a PhD. If you want to, that's great, but not everybody wants to. The other is you can often just be an advocate for yourself and other people like you in your community. So learning about STIs through webinars like these, telling your friends about, STIs and sort of what you learn, talking to family about this if you want. That is really a way that is sort of powerful to get the message out in your community and doesn't require you to go to school. You can say, hey, attended this cool webinar and I learned that chlamydia may not give you symptoms. Like that could help somebody. So I think even that's beneficial.
Yeah, and I think that conversation really helps by normalizing things too. And so just talking about stuff like this with your friends, whoever you're comfortable talking with, just making it a more normal conversation that we have. And then I'll add that everybody has a special set of skills, right? We don't have to all be clinicians or researchers, but whatever you can do, you can probably frame it in this direction. So I'm thinking if you're into policy, you can do some advocacy work there. If you love volunteering, go volunteer at a testing event and hand out flyers or something like that. Just think about what you're good at and try to align it with that and find somebody who is in this field and maybe can help you brainstorm what that looks like for you.
Yeah, agree.
So, Stacey and Chase, thank y'all so much for your presentations today. I know that I've learned a lot from them. I know that viewers will continue to learn so much for them. And for those watching this webinar, I think it's important to note that sexually transmitted infections include more than 30 pathogens, bacteria, and viruses. And during today's webinar, we were only able to cover a handful of them, but there are so many more, like human papillomavirus, genital herpes, trichomoniasis, all that can impact your health and all that are important to learn about. If you want to learn more about STIs, you can always visit ASHA sexualhealth.org. And you can visit stiwatch.org. And with that, I end our webinar.